Okay, so welcome to the weekly well-being deep dive. I do this every week to dive deeper into whatever topics people want to know about when it comes to well-being and self-care and all of that kind of stuff. So I'm also open to suggestions if anyone has any. Today we're talking about diagnosis and what it really means. And so I am just going to share my screen because I have a little slideshow for you, and we'll go ahead and get started. If you have any questions during any of this time, you can either put them in the chat or, um, oh, I did the wrong thing, um, or, you know, shout it out too if you can. And I will do my best to answer them. So, especially if you have any like pressing diagnosis that you want to dive deep into, I'm happy to look at that. So, it's my little cover page here. So, anyone who's ready to conquer chronic illness, this is the right place to be. Whether it's fibromyalgia or chronic fatigue or any kind of autoimmune disorder, digestive things, emotional stuff, hormones, I can help you fix that. And it's my favorite thing to do. So, it's time to live life on your terms. Let's get started.
Mm,
So, a question that I asked for a lot of my life, and a lot of my clients ask, is why am I still sick? And I think that one of the reasons that a lot of people are still sick is because healthcare kind of stops at the diagnosis. And that's why I think diagnosis is really an outdated practice. Because what is diagnosis? You go into your doctor's office, you have all these symptoms, you tell him or her what those symptoms are, and they put a name on it. So, like, I went in, remember this when I was 20 ish, I'd had all these symptoms for a long, long time, but I had joint pain, I had muscle pain, I had fatigue. It was all the time. It was really messing with my life. I couldn't do a lot with my life. And so they said I had fibromyalgia. Well, fibromyalgia, if you translate it, fibro is fibers, muscle, myo is muscle, and algia is pain. So really, the doctor just told me what I had told him in Latin, like just translated it. Like, I have all this pain. And he told me I had pain. And like, what does that really mean? And what does it do for you? So, lots of times, what diagnosis does for you is it just gives you a name for your symptoms. And for a lot of people, that feels like relief. And I totally understand that because you finally have an idea of what's going on. But the other thing it gives you is it gives you ownership of that diagnosis. So rather than saying, I have all these symptoms, you say, my fibromyalgia, or I have fibromyalgia, or I have migraines, or you talk about my migraines. And I've done this before. I'm not like criticizing people for doing this because I've done this. But it really tells your brain that you have these things and that they're yours. Personally, I don't want to keep any of those diagnoses. So I would rather not say I have these things. But diagnosis does that. And the other thing it does is it makes it easier um, for your symptoms to be matched up with something like a medication or a surgery, or lots of times to be told to just live with it. That's the one I hear a lot. I like to find the root cause, but these are kind of your options. So medications, I mean, sometimes they can work in the short term. I believe that medications should never be a long-term thing. If you need a medication to get you through some sort of short-term process, then that's okay. But just know that medications always put more stress on your symptoms. You've probably heard of those people who start taking a medication and then they have all these other weird symptoms come up. So they take another medication for those symptoms. Then they get more symptoms and they have another medication. That's because the medication is causing other things in your body. So, side effects, well, first of all, if you are put on a medication, you should definitely read the whole insert if you decide to take it. Just because you're prescribed something doesn't mean you have to take it. It's a choice. That's a doctor's recommendation. You don't have to follow that. You can follow your own intuition, but you should always read the insert and read all of the side effects. The side effects, it's kind of a misnomer. A side effect, those are all possible effects, along with the effect that you're being given the medication for. All of those are possible effects. So if any of them happen, that's what's likely to happen. And on pretty much every insert I've ever read, one of the side effects is death. Eh, it's a little scary. So medications, they always cause more stress on your body because your body doesn't know what to do with them. So your brain has to figure out, what is this? Can I use it? Do I need it? Where do I put it? How do I get it out of my system? And so all your other systems have to work, and it puts a lot of strain, especially on your stomach and your liver, in order to process that medication. And it's just as likely to have a side effect as it is the actual effect that you're taking it for. So I always advise caution and another opinion when it comes to taking a medication, because you don't know how it's going to affect your body. I've figured out how things affect me. I know that I have like opposite reactions. So, like, once I had a really bad wisdom tooth extraction and they gave me Vicodin, and I took one Vicodin and I thought I was going to die. I was in the worst pain I'd ever been in. It felt like someone was pushing a sheet of hot roofing steel through my skull. And that's the kind of reaction I have to medications. So I know that they can cause some havoc in your system. And anyone who's given a prescription should really get another opinion. Because, again, diagnosis. Is it really real? Or is it just a way to match up your symptoms with a medication? Because a lot of people have really similar symptoms and they get different diagnoses, but also they have like different things going on in their systems and different reactions. So it's kind of like a cookie cutter thing, when you get a medication for, or when you get a diagnosis and then you get a medication for that diagnosis. It's like they're putting you in a box. They're not seeing you necessarily as you. Option two, surgery. Scary. You can never put the body back after you've cut it up. You can't put it back the same way it was. And often surgery can be avoided. It's just not necessary a lot of the time. Always get another opinion if you're recommended to get surgery. I've had clients who have been told that they just need their gallbladder out when they haven't even like done a gallbladder cleanse or anything like that. So there are these things where you can do a lot of things to support your gallbladder. Or a classic one that I've helped prevent a lot of times is carpal tunnel syndrome. So the carpal tunnel is this little band of fascia in here in your wrists, and it holds all the tendons together. And there are 15 bones right here. So if those are misaligned, it can push on the fascia. You can get that adjusted by a chiropractor, or you can get it cut and stitched back together. Like, less invasive is always better, and surgery is always most invasive. So definitely get another opinion, especially if your diagnosis matches you to surgery. Kind of the most common thing I find with diagnosis is just live with it. You would not believe how many clients have come to me because they've been told that they have fill in the blank, whether it's fibromyalgia or rheumatoid arthritis or IBS or migraines or anything. I mean, usually they try a few medications. Lots of times those don't work because they're not getting to the root cause. But by the time my client has figured out that the medications don't work, they're told by their doctors to just live with it, or that it's their anxiety. Get that all the time. And for me, that to say that to someone, one, it's like taking away all their hope that they have any power over their healing. And really, we are all such deep healers. We have so much healing power in our bodies. We can create life. I mean, I grew a baby in my body. I would say I can heal my fibromyalgia or my migraines, which I did. So all good there. But if someone tells you to just live with something, oh, definitely get another opinion. And if they tell you it's just your anxiety, really brushing you off, because most people that I work with, they don't have anxiety. I see anxiety as just another one of those chronic and autoimmune disorders that I help people fix. It's not a reason to have pain or fatigue or any of that. So again, get another opinion. Because what's the most helpful, in my view, is finding the root cause of what's actually going on. And so that's what I love to help people do. So, health, root, well, trees, they all have roots, and illnesses have roots. And when you dig down and find that root cause, then you can address it. And rather than keeping on feeding that root that is causing illness and symptoms and stuff like that, you can feed the roots that are causing health. Because we all have so much health within us, but most of the time we're not feeding it very well. So our bodies are really amazing, and they're always doing the best they can with the information they have. They're always trying to heal and keep you surviving. But lots of times they have too much other stuff going on that they just can't handle in the moment. Lots of time that stuff comes in the form of infections. Maybe not infections that your MD would say, oh, you need to take an antibiotic for this, but infections that I can help you find in your blood work that that are really affecting you long term, and you've learned to just live with it. I've done it too. So by finding the root causes of what's actually going on and feeding the roots of your health rather than feeding the roots of your illness, there's a lot of health to be gained. And you can really create long lasting internal change when you're not just focusing on the diagnosis and treating the symptoms of the diagnosis. What I love to do is help people really rebuild their foundation of health so that they can start fresh and grow their health, not their illness. Because most of what the medical system does is just try to cover up those symptoms. Some of you may have seen my Instagram post from a few weeks ago where I posted a picture of a check engine light. So when you're given a medication for some symptoms or for a diagnosis, it's kind of like putting duct tape over that check engine light. So Lisa, I'm going to pick on you because I can see you right now, but like, what would you do if the check engine light in your car came on? I'm going to unmute you if I can. For some reason I can't, but maybe you can.
Well, I would probably take it and have it looked at.
Oh, yeah. So you take it to the mechanic and have them put in that little computery thing and find the actual cause of why the check engine light was on. Sound
Yes.
about right? Yeah. Good idea. And then fix the problem, right? So our medical system though, it looks at, so the symptom is like the check engine light. You know, that is the symptom that your car is presenting when something underneath that you can't see is going wrong. So when you have a symptom, it's like a check engine light coming on. But our medical system doesn't look at it like that. It looks at the system at the symptom as the problem. So that's like looking at the check engine light as the problem. If the check engine light was the problem, the duct tape, putting duct tape over it would actually work. But when you just take a medication to mask that symptom, you're essentially putting duct tape over the check engine light. You're not digging down into the root cause. So my work is all about digging down into that root cause so that you don't need a diagnosis, because diagnosis really doesn't give you a lot of information. Like I said earlier, it it puts a name onto your symptoms, but lots of times they're just telling you what you already told them you have. and and it doesn't do anything for you. It doesn't find what's actually going on. So, for people who are ready to find the roots of what's going on and create that long-lasting internal change, I am offering free consult calls, and there are several ways to reach me, but probably the easiest is to go to my website, which is drelizabethdavidson.com. So drelizabethdavidson.com, and you will see a button there that says schedule a free discovery call. Or you can just email me, happynerves@gmail.com, and I would love to get you a free consult and see if if digging down to these roots of your symptoms and throwing that diagnosis out the window is the right path for you. So now I would love to open it up. If you have any questions, I will do my best to answer. Any questions at all?
Well, I'll just say I feel like I'm the opposite. I feel like I'm looking for a diagnosis with everything that I've been dealing with for 9 months,
Hmm.
and yet they really tell me they don't have an answer
Yeah.
other than, "Well, let's try a medication."
Oh, thank you so much for bringing that up. Whenever they say, let's try something, like that's, I think it's very irresponsible because they haven't figured out what's actually going on. And that's what's happening in your
Mhm,
situation, right? They don't know what's actually going on, but yet they want to throw a medication at it.
mhm,
That does not make any sense. And even if they did have a diagnosis, like that still is often they don't actually know what's causing that diagnosis. They're just putting a name on it. So I totally understand how like you want to find what's wrong. I think diagnosis really kind of jumps over that because it doesn't actually find out what's wrong. It just puts a name
mhm.
on the symptoms. So that's where my work, and Lisa's lucky because she's gonna get some of my work. That's where my work, and you'll see soon, is really going after the cause of the symptoms rather than putting a name on it. And rather
Yeah,
and so with that, you can really target the treatment rather than just saying, "Oh, let's try this medication," which medications always put more stress on the system. Um, but rather than just trying something, you actually know you have the right thing. So,
well, I'll just say one other thing. First of all, it left me feeling hopeless,
mhm,
and then the second thing is I wanted to I wanted to diagnose myself, which is a very scary thing because you just go to the internet and you type in your symptoms and oh my goodness, it's terrifying.
yeah.
And then that just leads to more anxiety.
Mhm. And that tends to be what diagnosis does is be terrifying and leads to more anxiety. So I like to skip right over that part and
Yeah,
find what's actually going on. So, because anxiety and terror and all of that, it doesn't help you heal. Those are some of the things that
yeah.
keep you from healing. And I really believe that everyone has the power to, well, I know they have the power to heal. All of that healing power is within you, and that everyone should have the ability to access it.
Mhm.
So yeah, really excited to help people do that, and so they don't have to have that fear. Um, Fear doesn't help you grow, and
Mm-mm.
health should always be a growth process. Um, so does that make sense though? The difference between diagnosis, like putting a name on your symptoms, and then the other side of finding what's actually going on, because diagnosis doesn't tell you what's actually going on. Does that feel better?
Right. Mhm.
All right. Anything else?
No, I'm just excited.
Okay. Well, I do this workshop every week, same time, same place, Mondays at 1 p.m. Eastern, and it is free and open. You can get through it. You can get to it on Eventbrite, or I'll just post the links on YouTube also, so you can rewatch them. And anyone's welcome all the time, anytime. Next week, I am going to dive into what symptoms are and what symptoms mean. So that should be an interesting conversation too.
Right.
Okay. Um, so